Good afternoon, everyone. This is Dr. Bhupesh once again from Dr. BKM Institutes, and today we are going to take this topic. This is topic from original site, basically from the original website of OET, and this is by the Cambridge Box Hill Language Assessment. So this material is something that is kind of a thing that comes in the exam. That is why I always say, whenever you will get the exam, whenever you get the topic in the examination, when it comes to speaking, it would be this much. Everything will be given. You don't have to speak anything from your side. You will get 3 minutes to prepare. In 3 minutes, you can write anything on this. And after that, you should be able to speak 5 minutes. So even I have not done this topic priorly. So thanks to Cambridge Box Hill Language Assessment for creating this good sample test of speaking. And I'm just going to do it for you. So your 60-year-old patient has type 2 diabetes, which has been moderately well controlled by the diet and oral medication until now. However, recently, the patient's blood sugars have been high. The doctor has decided to commence insulin injections, and you are seeing the patient to show him how to administer injections. So basically, you are attending a patient who has been having type 2 diabetes and 60 years old. And his diabetes was well controlled until now. But what has happened recently is that blood sugars have been high. So insulin injections at this point is important. So confirm the reason for appointment. Self-administering insulin injections for diabetes. That is the reason that we have asked you to come to the clinic, because now you need insulin injections, and oral medications and diet cannot control as your sugar levels have been high. So we are here to teach you and to demonstrate you about self-administering injections for diabetes. Also, we would like to give you advice on it and what you need to observe while injecting the insulin injections. So could you please tell me, how do you feel about insulin injections? Well, nurse, it is really bad. I don't want injections. I'm happy to control my diabetes with the help of diet and oral medications. Why are you giving me injections? As I have already told you, so that these are the important lines. If somebody wants you to repeat, you need to repeat. As I have already told you that your sugar levels, blood sugar levels have been high. So it cannot be managed with the help of diet and oral medications. So that's why insulin injections are very important. But I'm very anxious about the injections. I have a lot of fear for needles and the pain and also the injecting process. See, don't worry, everything will be fine. So patient will say that I have all these fears. So you can ask like, why are you anxious? So you have to explore the reasons. That means you need to ask the patient, why do you feel that insulin injections are difficult? So patient will tell you that I'm having fear of injecting process. Reassure the patient about managing injections, clear instructions, easier with practice. Stress importance of insulin injections, faster absorption into the bloodstream, not broken down in the stomach. So if we give you oral insulin, then it will break down in the stomach. But whereas when we give you in the injections form, it is fastly absorbed and goes directly into the bloodstream, and it is more effective. That is why insulin injections are more effective than oral medications. Simple. Emphasize injections are the best option available. Current management not working. So basically they are saying currently these are the best options available. Again, I have always told you, whatever you feel that you do not understand, please, rather than speaking it wrong, do not include. If I cannot understand, I will not speak about it. उस चीज के कोई डिडक्शन ऑफ मार्क्स नहीं है. Explain injection giving process, washing and dry hands, pinching skin, insert needle, 40 to 90-degree angles, leaving in place 5 to 10 seconds. So take your time to inject and 45 to 90 degrees. Describe need to rotate the injection site, prevention formation of lumps, risk of less insulin absorption. Explain the importance of safe needle disposable, suitable containers, proper handling, outline the insulin storage, refrigerating unopened insulin, not exposing to sunlight, high temperatures, checking expiration dates, that when they are getting expired, establish patient willing to be observed, self-injective. So I have read the topic when I would be in the exam. So first line I have always told you should write. Good morning. My name is Bhupesh and you have been called here. That means in this clinic to teach you about insulin injections. Then patient will say something that, first line you should always write, no matter how good you become with passage of time. But in final exam, please write your first line in both the role plays. You will get 2 role plays because हम anxious होते हैं. We are anxious when there is an exam. So आराम से, good morning, my name is Bhupesh and you have been called here. ये passive voice, you have been. Been means B-E-E-N, sorry. You have been called here in this clinic to teach you about the insulin injections, but nurse, I do not want injections. So you can shuffle the questions. It's not important that you have to go line by line. Could you please tell me why don't you want insulin injections? Because I have a lot of fear of pain, injecting process as well as needle. Then explain karo, see, there is nothing to worry. Insulin injections are very simple and they can be easily given. And also I would like to tell you, they are not kind of muscular injections. They are just given subcutaneously, means just under the skin. So they are not painful. Simple. And also the process is very simple. We will teach you the process. So please don't worry. That is why I always say this big topic will come. So you can omit some points, you can delete some points. So that is up to you. So second point is ready. Then also I would like to tell you that you have been called for the self-administration of injections for diabetes. And also, how do you feel about the injection? This he will say. Reassure. So this point is also covered. Then patient will automatically say, I don't want injections. Reassure the patient that clear instructions. Then I am speaking up. Now I will like to tell you about the topic, but if you want to write something, you can in the exam in 3 minutes, that faster absorption. So I will write injections are better due to faster absorption. So this is my point. I would like to write that this point is all about why injections are important and easier with practice. So my another point is easier with practice. So I will write small points. If my English is good, I would be able to speak. So I will keep writing the points so that it does not become difficult for me in the later stages. Then emphasize the injections are best option available, injection giving process. So that means explaining the process. So here I will explain the process. That is my next point. That watch the needle, this and this. Then last, disposable. So last is disposing needle. So now my whole topic is ready. Now I will give it a final shot if I'm ready. So good morning. My name is Bhupesh and you have been called here in this clinic to teach you about the insulin injections. So are you ready for the insulin injections? Well, nurse, no, I'm not ready. See, my diabetes have been well controlled with the help of diet and oral medications until now. I don't want to have any kind of injection. See, let me explain you that you have been called here so that we can teach you about self-administration of insulin injections, basically to decrease the level of your glucose. Right now, your blood sugar level has been very high. So it is very important to take this injection. And at this point of time, diet and oral medications are not enough to control your blood sugar level. So it is necessary to take the injections to control your sugar level. But nurse, I'm really afraid of injections. What can I do? And again, medicines topics are not different. So it can be doctor as well. So doctor, but I don't want these injections. I'm very anxious. I don't know how to do that. Don't worry, we are here to teach you about this injecting process. So I will explain you later about the injection process, but I would like to tell you that there is nothing to be fearful about insulin injections because they are not painful as they are given subcutaneously. That means just under the skin. So they are not kind of other injections which are given in the intermuscular or intramuscular level. So they do not go that deep. So they are not painful at all and they can be easily taken. Millions of people are taking insulin injections by themselves, and this has been very successful with no side effects at all. So you would be able to do that. All right, but nurse, why do I need these injections? Can't I manage with diet and medications? As I have already told you, the diet and medications will not be effective at this point of time. Injections are really successful because of number of reasons. They are fastly absorbed into the bloodstream when they are injected, because when we give it in the stomach, they get the insulin gets broken down and it is not effective. So it is very important to take these injections rather than taking it oral medications, and they show more effect. That means they are more effective when given in the form of injections. So do you have any doubt? Well, no, nurse, I do not have doubt, but I still don't know how to inject. Don't worry. I would like to tell you about the injecting process as well. First of all, you need to wash and dry your hands. Then you need to pinch the skin and insert the needle at 45 to 90-degree angles. Keep injecting it for 5 to 10 seconds. Do not rush. Give injection slowly to yourself. You should not rush this injection. Is it all good? Yes, nurse. Okay. Also, it is very important to rotate the injection site. That means if you are taking it on the thigh, or if you are taking it on one thigh, then try to rotate it to other thigh or to the calf. Wherever you want to inject, we will tell you the sites. So you need to shuffle the sites. You can't use the same site every time, because using the same site can lead to formation of lumps, and also it can lead to less absorption of insulin. So have you understood? Yes. Okay, that's great. Now, after injecting the needle, it is very important to discard the needle in the safest possible way. So there should be suitable containers which are available. So we will help you to buy the containers. Also, proper care and handling should be done for the needles, because they can be a source of infection for the rest of the family members. Also, I would like to tell you about the storage of insulin injections. Basically, the insulin should be stored in refrigerators and it should be unopened. They should not be exposed to sunlight or high temperatures. And also, you have to check the expiry dates of injection every time. Is it all good? Yes, nurse. Well, that's great. I think you have understood whole of the process. Again, I would like to reassure you, there is nothing to worry. It's a very simple process, and self-injecting insulin is not painful. So there is nothing to worry. Well, that's fine, nurse. Okay. All right, that's great. And now I am leaving. I'm giving you this pamphlet. It contains the pictures which are demonstrated how to take the injection, and also the instructions. Still, if there is any doubt that persists, there is a number on the leaflet or on the pamphlet. You can contact on that number anytime. Is it all good? Yes, nurse. Okay, well, that's great. So you should inject yourself. If you feel any difficulty, you can always let us know. All right, nurse. Okay, thanks. Take care. That is how you do your topic in the best possible way and in a very nice way. This is Dr. Bhupesh from Dr. BKM Institutes. And again, thanks to Cambridge Boxell for creating this nice speaking sample question paper, because this is the kind of the question paper you will get, and it's very easy to cover 5 minutes. And reassurance is very important. Giving leaflet is a very good idea. So you should use this idea. So now I am holding the speaking and will like to take your doubts. Thank you.